Well, let's stay with health news for you this morning because thousands of women with breast cancer could be treated with a single 30-minute dose of radiotherapy instead of having to make multiple trips to the hospital for treatment. Let's go to central London. We can talk to Professor Jayant Wajah, who's been involved in the clinical trials of this particular treatment. Good morning to you. Look, how effective is a single dose of radiotherapy at the time of surgery compared to the current methods being used?
Well, in our large clinical trial involving over 3,500 patients, which were treated in 33 centers in 11 countries, we found that when you give it at the time of lumpectomy, intraoperative radiotherapy appears to be as effective as whole breast radiotherapy. The difference between the two treatments for breast cancer outcomes was not statistically different. What we found is also that the number of patients who died from other causes was significantly lower by a small number when you give treatment during surgery.
Are there any concerns or any disadvantages with this sort of treatment?
Well, there don't seem to be. We had initially were concerned that perhaps there might be problems in wound healing, but we didn't find that. So we find that the patients recover very quickly. Many times they go home the same day. And it is the woman, for a woman with breast cancer, the most important benefit is that her local treatment is completed when she has her cancer removed during surgery with a lumpectomy. Targeted intraoperative radiotherapy is given during surgery, and that is enough as local treatment. That's what we have found in 80% of such women.
I mean, is there going to be a benefit to the patient in this, in quality of life, if you like, in the fact that they're not having to go for radiotherapy and with that concern that carries for weeks after a lumpectomy?
Indeed, you said it very well. The patients normally, after a lumpectomy, have to go for radiotherapy every day, from Monday to Friday, for between 3 to 6 weeks. And that is avoided by giving this single dose in the operation theatre, because it is targeted to the correct tissues, to the fresh tumor bed where the chances of cancer coming back is present, and you give the radiation during surgery in front of the surgeon's eyes to the correct tissues at the correct time. So it is the accuracy and immediacy of the treatment that appears to be very important.
Does there have to be more trials on this before it can be, you can be completely sure it is going to be as effective, at least, as the current system?
Well, we have had this. In olden days, we used to have small trials, so we needed to do multiple trials, and they used to involve 200 or 300 patients. Now, this trial was a very large trial, 3,451 patients, and we started this back in 1998, and the first patient in the trial was recruited in 2000. So it is now going on for 14 to 15 years. So we have had a large enough cohort of patients treated in clinical trials to give us a very reliable and robust answer to say that it is very unlikely that this is going to be less effective in terms of breast cancer control, and it appears to have less toxicity. So I think we now have enough data to reliably start using this in normal clinical settings, and that is probably why NICE has given this provisional draft guidance to go ahead with it.
It's certainly very encouraging news. Professor, appreciate your time. Thank you.
Thank you.
Kevin Adams, we've got to reflect on that, actually, haven't we?
That is absolutely amazing, I have to say, because I know a lot of women, I don't know if you do, but certainly in sort of getting younger and younger, actually, having to go for breast cancer treatment. This is astonishing, and you could see the joy on his face.
Yeah, it's amazing.
Incredible.
I've had a friend that's just gone through breast cancer and had reconstructive surgery, and this would just, it's so amazing.
The idea that you can have that treatment at the point of surgery and then be clear, or not have to go every day, because it's the stress, actually.
Yes,
it's the emotional stress and the stress on the family of having to go for that kind of chemo. I think it's extraordinary.
Yeah, brilliant. Look, let's look through the papers this morning. I want to start, if we can, on